So a male hairy woodpecker presented after most likely hitting a window in a residential area. So we're going to perform a physical exam, beak to toe, and treat him for inflammation associated with head trauma. So with most exams, we'll start at the head and check our special senses out first, including an ophthalmic exam, which is particularly important. Open up in head trauma cases. Other side. Checking for retinal detachments or evidence of asymmetry between the eyes. Typically also like to check the ears for hemorrhage or bruising. And then I usually will glance at the back of the head. We do sometimes see bruising there. Okay. Next we're going to do a quick oral exam. Magnification helps for smaller birds. And we will palpate the keel. That's the breastbone in birds that's shaped like the keel of a ship. This helps us determine the body condition of the bird. I'm palpating now the thoracic girdle and coracoid bones, clavicles, to try to palpate for asymmetry. Next I'm going to have my holder lift the legs a little bit and palpate the abdomen. Just tuck these feet in here, bud. Reach under your hand. Evaluate the tail just a little bit for feather damage. They have a fairly robust, strong tail for perching. Some species have a uropygial gland, which is what I was just looking for in the back and evaluating. Next I'm going to move on to the wings and palpate again the thoracic girdle, that's the shoulder, without disturbing the feathers too much. Palpate for mobility and crepitus or bone grinding. Palpate down the humerus, the elbow, radius and ulna. We've got a wound here on the left wing. This was a presumed hit by window. We don't or hit a window. We don't actually have that confirmed. So anytime a small bird like this is found in a residential area, we want to consider a cat attack. He's missing a flight feather here. And that's where it inserted. So for that reason we'll want to get him on some antibiotics and clean that wound up a little bit. Check the other wing. Same protocol. Shoulder, humerus, elbow, radius and ulna. Palpate the carpus. Normal wing there. Missing one of the feathers way at the base of the wing. Probably not going to impact him much. And then I'll take this right leg from you and I'll palpate the hip. Take his leg through some range of motion. Femur. Stifle. Tarsus. Check his feet and check for grip strength. Okay. Missing a tail or a nail on this toe here. Looks like a chronic old injury. He's obviously been living with that without a problem. Okay, hip. There we go. Hip, femur, stifle, tibiotarsus, tarsus, tarsum metatarsus. Okay. Finally, we'll do an auscultation. Listen to heart and lungs, respiratory sounds. We'll also listen to the air sacs of the abdomen. One oscillate from the back too. Okay, so next we're going to get some x-rays of this bird, and then we'll treat them for swelling and inflammation and pain with meloxicam, a non-steroidal anti-inflammatory, and then get them on some antibiotics as well for the soft tissue injury. So this bird is going to get some x-rays taken inside our bird board. Not that we can't restrain him manually, but it's much easier to get a straight x-ray on an awake bird using this restraint device. It's important when taking images via x-ray that you maintain a symmetry, make sure that the bird is straight in order to aid with interpretation. In high-stress animals, this should be done under anesthesia. Okay, so the patient's prepared. We'll take some x-rays. So we're going to give subcutaneous fluid administration. Along with his medications. And he's ready to go in his cage.